Welcome Above Party Lines, the podcast where it doesn't matter anymore what party you are. I think we will get united now through the problems what are coming up or are there already, the price increases and everything. It doesn't matter what you hear. You can go shopping and then you can see how much you are paying. So it doesn't really matter what people are saying on any TV stations. You can experience for yourself when you go to Walmart or to Publix or wherever you are. And then you just remember how much you paid for the Gala apples. I bought it for $5.28 and then I just grabbed the bag and it's $7.80. Same Gala, same amount, and it's just not happening. So I switched to Aldi's. By the way, Aldi's is a German company originally, and I know Aldi's when I was still in Germany, when I was born there. I grew up with Aldi's. They have one of the highest qualities for food what you can buy, and it's a huge brand in Europe. It's huge, and meanwhile, it's really huge in the US too, and it costs, I would say, easily in an average like a third less than Publix. So I strongly recommend to take a look at Aldi's and take a look if you find the products you want. Organic is also relatively cheap, very affordable. Strongly recommend. Go to Aldi's, take a look at it, and I believe you will like it. You will save so much money. It will be hundreds a month when you go shopping, especially when you have even children, so where you have to spend even more for food. And just try it. Aldi is really the place to go, and I'm not even sponsored by Aldi. Aldi doesn't sponsor because they don't spend a single cent more than they have to when they buy. So this is how their purchase department functions. So not a cent too much. So try it, Aldi. But that's not the thing what I want to talk about today. Today, healthcare, health insurance. Health insurance is our business, because I'm also in that problem. So we paid $1,045 for two, and we have our own businesses, so small business, and I'm the only one employed in my business, and same thing with my husband. So we had this $1,045 with Cigna Florida Connect, and we got a letter like 4 weeks ago. It says that our insurance will go up to $2,580 now. So that's like almost 150%, which is just impossible. If you are a small business owner, to get an increase of $150, not possible. So if you want to still live beside paying your health insurance, by the way, this amount comes with a $10,000 deductible for me, and $10,000 deductible for my husband too. So that's what we are looking at. So I was shopping around, taking a look what's on the market, and I have to say, this is the American problem. There is a lot of shit on the market. There's a lot of garbage. They want to give you like for $40, $50 a month, and then you have a cap of $250,000. That means when something happens to you, you go to the hospital, you have to go to the ER. The ER, sometimes they charge you like $35,000, $40,000 for a night. Sometimes even more. It depends what kind of fraud is going on in your hospital, because there's a billing fraud in every hospital, what I see here. Now, I don't know how it's up north. I just can talk here about Florida. I had to hire a lawyer when I had my spine surgery, outpatient surgery here in Boca Raton, in Boca West, and they came up a 3-hour. I was in and out in 3 hours. My insurance paid $6,800 for the 3 hours just for the hospital, no doctor involved there. And the hospital comes 7 months later and wants $44,000 from me for 3 hours. So here is the fraud. I had to hire a lawyer, which was like fraudulent billing, blah, blah. You know, you're American, you know what's going on here. It's all fraud. It's unbelievable. So what are we doing now? So when these bills are coming up, can you imagine when you have something serious? You are not 3 hours in the hospital. You are there for I don't know, 1 week or 10 days, and it's not your fault, you have some serious illness, do you know what $250,000 does? Nothing. That's nothing. $250,000, it's nothing. Forget that. You can save the $50 a month because $250 in the US is just nothing. So you need to take a look. I hate these cap things, but probably you will not have another choice than taking, there's a 1 million cap insurance I can see. There's also, I saw 2 million cap. If you can afford 2 million, it's a good idea. Take that. Take whatever you can for the next year. We have to survive this year before maybe some changes are coming up with some changes in the political spectrum in the healthcare business. This needs to completely to be redone. It needs to be completely redone. And I am talking here about really millions of people who will not have health insurance or have some garbage like this 250,000 cap, which is not doing anything. And then the self-pay part is still like $10,000. So also, the people who have more citizenships than the American, they have an alternative. There are insurances out there, American insurances. You need to think about that. American insurances are offering to people who are Americans and have another passport too. Another passport could be anything from Europe, could be Australia, Japan, New Zealand. They get better prices for the insurance. It's called Global. It's an insurance, the name of the insurer, Global. So if you have a second passport, a second citizenship, you can apply through that second citizenship for a better price. Now, where is that fair? Where is that fair? I'm telling you, this what's going on, these effing Americans, above party lines, forget that now, forget the parties. This is just here in this country. You were taken, like, they take advantage, the whole businesses, these corporations take advantage of you in the healthcare business in ways I have never seen in any other country before. So this is so screwed up. Honestly, I don't even know where to start. I think the easiest thing to start, where everything needs to start, is that you as an American, as the patient, you cannot see any bills, because this is not your problem. The billing cannot be your problem. In all the other countries, the billing is not your problem. The contract is always between the insurer, means the insurance company, and the hospital. The insurance company and the doctors. That's what the contract is. Your contract is only with your insurer, and just that. Your insurer tells you what you have to pay, you pay the insurer, and that's then it. So a hospital can never touch you, can never get back to you with some bullshit bills where nobody knows where it's coming from. This can never, in no other country, nobody has that. No developed, let's put it that way, no developed country. I don't know what's going on in like poor countries, that I don't know. But in developed countries, this is just not happening. So you will never, ever see a bill in other developed countries, what went on in the hospital or not, because you as a person, you do not have negotiation powers. And the hospitals know that. The doctors know that. They're all millionaires. The hospital, they go after you with all this billing crap, and if you don't hire a lawyer because you don't have the money for a lawyer, you are so screwed, and they know that. They just know that. And now, till this year, normally the medical bills should have been removed from your credit score. Now the government destroyed that part, so your medical bills again will be on your credit score, even though they are lying, the hospitals are lying to you in the invoices, and you get this fraudulent medical bill on your credit score. So you pay double. You are double. This cannot be. It just cannot be. You know, I'm an economist and I'm very rational. This is completely screwing the Americans. And it doesn't matter if you are MAGA, if you are just a normal Republican or a Democrat or left-leaning or whatever leaning. It doesn't matter. All of you, small businesses, you all get screwed. By the way, even if you are not small business and you have a better health insurance, if you are working corporate, still they screw you. You have to still double check the bills because there it's the same thing. And nobody cares. Nobody cares. Nobody cares how you survive. Nobody cares how you can make it. It's just, I have never seen such a mess. So the first thing what needs to go is that you get a bill. It cannot be that you get a bill. The insurance has to be completely responsible for every bill what's coming out of a hospital. They can negotiate what's going on there. You just pay everything to the insurance. But all this, that's the number one that has to go. So I was open to different kind of insurances, looking into private and all of that. I had private insurance. I had the regular insurance in Germany too. So I had different styles of insurance. I had here a private here in the US. I looked into that. So I looked different things. And meanwhile, after 20 years, I believe that the universal healthcare system is the only system what really would work for the US. Clean cut, rebuild. It has to start with zero again. Otherwise, this is a nightmare. This is not working for anybody beside the insurance companies who just want to make more profit and more profit. By the way, in Germany, I don't know how it is in other countries, but in Germany, if you are not privately insured, it's just after 120,000 euro income a year, I think you can switch to a private insurance. Under that, everybody has to be in a regular insurance, and that regular insurance is a non-profit. And so sometimes they make 10 billion more, sometimes they have 8 billion minus, so they equalize each other out, and sometimes I got money back when I paid more in. Sometimes you get 800 euro back at the end of the year if you paid more than you were spending. So I thought that's a relatively good system. It's not perfect, but it's relatively good, and you don't have nightmares when you go through a cancer treatment because you don't even know where to get the money from. You just don't see the bill. You go, you relax, and you get your treatment. As a cancer patient, you never have to think one single moment about the money because everything is covered. That's not cheap either, but we have mandated insurance, so there's no discussion. You want to have insurance or you don't. You have to have. It's just the law. That's it. And I'm now at that point that I believe that this universal healthcare, where everybody has to have a minimum insurance, basically covered, where the hospitals are not allowed to contact you. They can only contact the insurer. That's the only way to go. There's no other else. But still, all this, it doesn't help you. It doesn't help you because we are now so effed because the mammogram is not covered or maybe covered or nobody knows. I'm calling around. It looks like my gynecologist is in network. I call the gynecologist. No, we are not in that network. I said, but you are on the list. Yeah, I don't know. We are not on that list. We are on a different list. So the insurer does not know which doctor is on the list, in network, out of network. Nobody knows anything. So this is where we are right now. This is where we are, December 8, 2025, in the United States of America. Nobody knows anything. How do we survive now the year? Honestly, you do every mammogram, everything what you can in December. Blood work, whatever you can. Do it till the end of the year. I believe there will be big changes coming next fall, but that also will take a while till we are getting back on our feet in the healthcare business to what means here in the US is normal. you need to, everything what you have to do, every cancer thing, everything, try to check through everything what you can now in December. Have your tetanus vaccinations, have every vaccinations you need. I'm very, very sensitive to COVID. I got very sick before vaccination, very, very sick. I almost died, even though I'm very healthy and juicing every day and skinny, kind of. Kind of. I work out every day, and I still got very, very sick with COVID. So I took the new COVID shot last week just to make sure that I get through hopefully the next year without any additional COVID garbage. So we will see. So you take the vaccinations, what you think is necessary and what you need. And then let's go into next year. Whatever you can afford on insurance, buy something. I would not go under a limit of 1 million, for sure not. That's the absolute minimum what you should look at. 1 million, better 2 million. So I signed up with without a cap, but we pay now $1,280 a month and 10,000 self-pay. It's a catastrophe. We need to survive 2026 with this garbage, what's now there as Americans. I believe in the fall there will be some big changes coming. So that's the only hope I can give you right now. So, and work out, juice, eat a lot of fruits and veggies, everything what you can do by nature, everything. Go walking, go 3 times, 4 times a week walking for 20, 30 minutes. Eat as healthy as possible, because everything what's coming now in the next year, you get sick, there is no control on the costs. There is the whole healthcare system is completely out of control. You need to work the best you can to stay healthy for minimum 1 year or maybe longer. We will see. Try your very best. Healthy, healthy, healthy. And if you want to take a podcast look at Secrets of a Personal Trainer, I have a bunch of podcasts over there on Spotify and on iTunes and iHeart. You can take a look how to keep your body healthy, and you will save a lot of money if you don't get sick, especially 2026. Reboot your health today. Today is the day you have to get started.